And welcome to this session on advanced GI bleeding techniques, part 1. We're going to try and master advanced upper GI bleeding, and we will discuss techniques for clinical excellence. So we're going to start with a lecture, and we are going to weave in a live case as well. Can I have the session objectives, please?
You can click.
So we're going to review the pros and cons of different endoscopic modalities for managing GI bleeding, learn strategies for accurate lesion assessment in upper GI bleeding, and discover new treatments and technologies for optimal management of GI bleeding. As ever, we've got a quiz question. According to the Forest classification, what is the classification of the ulcer in the image? The first one to answer, who has logged in with their email address, will win 10 GIEQs coins, which can be used later on.
So the idea of this part of the presentation, which will take approximately 7 minutes, is about how it's as important when you are presented with a patient who has had GI bleeding, it's as important to go looking for a lesion, and by a lesion in this case we can translate to a blood vessel, as it is when you are looking for cancer in all of the things that we've talked about till now, right? So the whole day until now has been focused on doing a upper gastrointestinal endoscopy and looking for cancer and making sure you don't have cancer, and then, okay, figuring out what else is going on with the patient. In this case, we are presented with a patient who has had either melena or hematemesis or whatever they've had, and we're going looking for another type of lesion, but it is not a cancer, or though it may be, it is in this instance, in the acute situation, a bleeding. So how can we apply a structured approach to upper GI bleeding, which fulfills the things I've just said, easily risk stratify the chance of rebleeding, and define the best treatment option?
So messages: take a good history in these patients who are bleeding, focus your physical exam, including digital rectal exam, establish a differential diagnosis, risk stratify, resuscitate the patients, restrict a blood transfusion policy, which you didn't talk about any of these things, manage their antithrombotics if they're taking it, know your hemostasis equipment, have a plan B or C or D, as John has said, and GI endoscopy nurse coverage 24/7. And I will stop there.
Thank you.